we'll begin about the detailed sector. And if you do have any question, then please don't hesitate to ask. So, again, I welcome you all, and we are going to explore the fundamental concepts of health and ill health, as well as the invaluable role that health data and research play in shaping our understanding of these areas. So we have to discuss about learning outcome for today, and that is can use health data and research, and it's related with the health and ill health. So first I will go with uh, health and ill health. So what it means to be healthy. The first question would be this. So health is not just about not being sick. It's about feeling good physically, mentally, and socially. One flip side, ill health refers to a state where our bodies or mind aren't functioning at their best. To better grasp this, so we will break down into different components. Uh, so first we have physical health example. So for example, physical health involves taking care of our bodies through activities like exercise and proper nutrition. Imagine you have a friend who eats a nutritious meal and exercises regularly. They are likely to have better physical health compared to someone who does not prioritize these habits. Then, if you go for mental health example, so uh, mental health example would include managing stress, seeking help when needed, and fostering a positive mindset. Picture a scenario where someone practices mindfulness to reduce stress and improve their well-being. Then we have social health. So lastly, social health emphasizes the importance of meaningful relationship and positive social interactions. So we can think about the impact of having a strong support system on an individual's social health. And in the context, we have uh, health data and research. So when it comes to health data and research, they are instrumental in guiding healthcare decisions and practices. Studies and data help us understand diseases, evaluate treatments, and shape healthcare policies. So, uh, any question, please do ask. We'll go for the applying research example. So, uh, we can imagine a study that analyzes the effectiveness of a new drug in treating a specific condition. So researchers collect data, analyze the results, and draw conclusions that can influence medical practices. This highlights how research impacts healthcare decisions. Then we have public health data example. So we can consider an epidemiological study tracking the spread of a disease in a population. And by analyzing data trends, experts can develop strategies to contain outbreaks and protect public health. This illustrates the vital role of data in representing to health crisis. So, by incorporating practical examples and interactive decision, we can deepen our understanding of uh, health and ill health and the critical role of health and data and research in shaping healthcare practices and policies. So discuss everything in detail. Uh, so go to the next slide. In the next slide, we have to discuss about the indicative content. So now we have to explore health data and research sources such as the UK's NHS, NHS Digital, and the World Health Organization. They all can provide valuable insight into various aspects of healthcare. So first we go for National Health Services, NHS, and the NHS conducts a wide range of research using methodologies like randomized controlled trial, cohort studies, and qualitative research methods to investigate healthcare intervention and outcome. And if we talk about the data analysis, then researchers in the NHS utilize statistical tools and software to analyze data collected from clinical trials, patient records, and surveys to draw meaningful conclusions and insight for healthcare practices. Then we have data management, right? So for data management, NHS employs uh, uh, a system to ensure the security and integrity of patient information and research data while complying with data protection regulations. Then we have ethics and research governance. So for that, ethical guidelines and research governance framework govern research practices within the NHS to ensure the protection of participant rights and the integrity of research process. Then we have uh, dissemination of data and research. So NHS disseminates research findings through peer-reviewed journals, conferences, and online platforms to share knowledge and promote evidence-based healthcare practices. Now we go for NHS Digital. So if we talk about NHS Digital UK, so what research methodologies NHS Digital uses a variety of research methodologies such as data mining, retrospective analysis, and population surveys to evaluate healthcare service utilization and healthcare outcome. Then for data analysis, NHS Digital employ advanced analytical technique to extract insight from large data sets, enabling informed decision making in healthcare policy and service delivery. For data management, data governance protocols at NHS Digital ensures the secure handling of sensitive healthcare data, maintaining confidentiality and data accuracy throughout research projects. And if we talk about the ethics and research governance, then adherence to data protection law, confidentiality agreement, and ethical guidelines underpin research activities at NHS Digital to safeguard patient privacy and research integrity. Then NHS Digital disseminates research findings through reports, data visualization, and data reports and data portals to inform the public, healthcare professional, and policymakers about trends in healthcare data. Now, if we talk about World Health Organization, so research for research methodologies, we can say World Health Organization employs diverse research methodologies such as cross-sectional studies, systematic reviews, and health impact assessment to address global health challenges and develop evidence-based policies. Then for data analysis, so statistical analysis and modeling techniques are used by World Health Organization researchers to interpret health data from various countries and regions, aiding in monitoring health trend and guiding public health intervention. For data management practices ensure the accuracy and reliability of global health data collected by the World Health Organization, and maintaining data quality and consistency across different research initiatives are important aspects for WHO. Then for ethics and research governance, World Health Organization uphold ethical standards in research, adhering to international guidelines and ethical review processes uh, to ensure that research activities prioritize the well-being and rights of participants. Then for uh, dimension of data research, World Health Organization designates research finding through publications, reports, and databases accessible to government organization and the public, facilitating the exchange of knowledge and best practices in global health. So generally, if we talk about critical review of research, then uh, if we have to do the critical review, so it's essential to ask appropriate questions regarding the research methodology, data sources, analysis technique, potential biases, and the relevance of the finding to the research question. Then we have the second important point is validating research and data sources involved, assessing the credibility of the authors, the reliability of the data collection method, the transparency of the analysis process, and the consistency of result with existing literature. And to interpreting data in graphs, so we need to understand that data involves systematically analyzing graphs, charts, and numerical data to identify patterns, trends, and relationships within the data. So then we have some steps to carry out data analysis and interpretation. It includes defining research objectives, collecting relevant data, organizing and cleaning data, applying statistical techniques, and drawing conclusions based on the analysis. Then, if we talk about health and statistical technology, so for that, we need to familiarize ourselves with health terminology such as morbidity, mortality rates, prevalence, incidence, and some terms like mean, median, mode, standard deviation, hypothesis testing, and p-values. These all are crucial for effectively communicating and interpreting health data and research outcomes. So this is all about the interactive content. So we have key terminologies here. So right. So first one is the electronic health record, and so these are digital records contain vital patient information like medical history, diagnosis, treatment, and medication. And electronic health records serve as valuable sources of health data for research purposes, enabling detailed analysis of patient care patterns and outcomes. And big data. So big data has large and um, intricate data sets um, that has the information from diverse sources such as electronic health records, uh, genomic data, wearable devices, and social determinants of health. And researchers leverage big data analytics to uncover correlation, trends, and insight that can inform healthcare strategy and intervention. Then we have precision medicine. So precision medicine tailors medical treatment to individual patient based on genetic profile, lifestyle factors, and other personalized data. Advanced health data research is fundamental in progressing precision medicine by enabling targeting and affecting patient care. Then that clinical trial, right? So clinical trials it involves human participants to evaluate the safety and efficacy of new treatment and intervention. And data derived from clinical trials constitutes a cornerstone of evidence-based medicine, guiding clinical decisions and therapeutic approaches. That's health informatics. So, an interdisciplinary field merging healthcare, information technology, and data sciences to optimize health data management and healthcare system. It has health informatics and focuses on leveraging data-driven insight to enhance patient outcome, streamline healthcare processes, and improve overall care quality. Then we have data privacy and security. So safeguarding the privacy and security of health data is paramount to protect patient-sensitive information and uphold ethical standards. And adherence to data privacy regulation and best practices is crucial in maintaining patient trust and ensuring data confidentiality. Then we have machine learning and artificial intelligence. So these cutting-edge technology uses algorithms to analyze health data, predict disease outcome, and enhance data diagnostic accuracy. All applications play a vital role in revolutionizing healthcare by enabling personalized care, early disease detection, and improved healthcare decision making. So, about this slide.
Going into an office, working 50 hours a week, having that structure.
Hi everyone, it's really nice to see you all and thank you so much for having me join you today. As Sarah said, I'm Sadija and I'm the Patient and Public Involvement and Engagement Officer for what's known as a central team within HDR UK. So apart from the fact that means I may have one of the longest job titles in my team, my role is very much to run and oversee patient and public involvement and engagement activities within the central team, but also have oversight of activities across the whole HDR UK Institute. So I will try my best to explain how it all fits together as we go on, but I will say I could spend a whole day just talking about one section. So this is very much a brief overview, and I'm more than happy to answer questions either at the end or even after the session. So I thought let's start off with who are HDR UK. So HDR UK was launched in April 2018, and our mission is to unite the UK's health data to enable discoveries that improve people's lives. The population's health data is so diverse, and it really does provide an opportunity to drive innovation. So what that means is that we work in partnership with the NHS, with industry, with researchers, and of course patients and the public to provide safe and secure access to health data. We are a convener and work as one single national institute. There are a lot of fancy words you'll find, but what that really means is that we bring together different themes and organisations who fall within the HDR UK umbrella. We are funded by 10 different organisations. including the Medical Research Council, Wellcome, UK Research and Innovation, the British Heart Foundation are just a few. However, one thing I really do want to emphasise is that whilst we facilitate the safe and secure access of data, we do not hold any data ourselves. We are not a data controller or a data custodian, and so whilst we may work with those who do, we do not hold the data. We often get requests to access data, and people ask us what kind of data we hold. So it is a constant reminder to people. So if there's one thing you can take away from my presentation, please spread that news. So Health Data Research UK is the only national institute of health data that includes England, Wales, Scotland and Northern Ireland. We were established to work with a wide range of health data from the NHS, universities, charities, and more recently, we're also seeing an increase in data from wearables and private companies too. So to establish the kind of health data research infrastructure, our aim is to unite the health data, improve the health data, and use the health data. Different teams work within each of these areas, and then the central team, of which I'm a part of, supports all of the different areas. So I thought I'd give you a really brief overview of the different areas and also really emphasise where the multi-omics work sits as well, so that you have a bit more of an understanding of how it kind of works together. So let's start with uniting the health data. As the name suggests, it's about uniting health data to enable safe and secure access of health data. So within this area of work is the UK Health Data Research Alliance and the Innovation Gateway. The Alliance is a group of data custodians. So data custodians are people who hold data, who work together to offer the opportunity for researchers or innovators to access rich and diverse health data, but it is done in a trustworthy and ethical way. On the other side of things, there's the Innovation Gateway, which kind of acts like a portal to enable researchers and innovators to discover and find out about the UK health data sets that are available. So if you go onto the Gateway, and I'm more than happy to show you what it looks like, it provides information about the different data sets that are available, and all these data sets are held by members of the UK Health Data Research Alliance. So this information could include a description of the data set, the size of the population, the legal basis for access, the process in which you would need to access the data, things like that. But ultimately, the work we do through the Alliance and the Gateway needs to be in a way that earns the trust of patients and public, which is why it's so important to us that we involve patients and the public in this area of work. We can then move on to improving health data. So this is all about providing the tools, the methods, and really the national expertise in improving the quality of health data for use by researchers and innovators. So this could be using tools and methods such as analytics, or work with our 8 health data research hubs. So these 8 data research hubs are at the bottom here, and they include gut reaction, which kind of looks after IBD, inflammatory bowel disease data, Breathe, which looks after respiratory health data, DataCan is cancer data, DigiTrials is around clinical trials data, Insight is around kind of eye health, and then we've got the BHF Data Science Centre, and that one looks after cardiovascular disease, and the reason it's got BHF is because it is funded by the British Heart Foundation. And then applied analytics and human phenome are kind of tools that can be used to improve health data. But the one that which may be most applicable to you is the using the health data. So this area of work looks at the different research priorities and enables research and innovation by offering new and exciting approaches to health data use. So as well as actually kind of being able to use the health data for research, our training program to train health data scientists to really grow an expert group of national research leaders in health data science also falls within using the health data stream. Just sticking within the kind of using health data, there are different sites across the UK, and this includes Scotland, Wales and Northern Ireland, and of course Cambridge. And we see teams working across these sites to focus on key priorities. So each priority has a lead that is in the different sites, but there are projects within each priority that sit across. So for example, with the multi-omics work or understanding causes of disease, whilst the leads may be in Cambridge, there are projects happening across the different sites, such as London, for example. So it's about how can we collaborate and how can we bring people together.
Don't buy another pair of glasses until you've seen what this new invention can do. These self-adjustable
if we look at the continue to look at the using the data side of things, there are different priorities, and these are understanding the causes of disease, better, faster and more efficient clinical trials, improving public health and better care. So the Better Care programme is actually still in development, and its aim is to improve people's lives by equipping clinicians and patients with the best possible information that uses data to make information about their care. So in December last year, we had announced 2 opportunities for organisations across the UK to submit bids to enable better patient care through the use of health data. These organisations have now been awarded funding, and they are based, one is based in the north and one is based in the southwest. So we're really adding to our number of sites, which is great. But what's really great about that one is that they really do see the value of patient and public involvement, and right from the very beginning, they've had their patient and public involvement plans embedded into their application, and some of them are currently recruiting at the moment. So I can definitely share information with you if you are interested in more of that. Hopefully that gives you a taste for the different areas of work, and it is a lot of different areas of work and something that has grown significantly. As you can see from this slide, there has been a huge growth from our launch in 2018. So as well as growing the number of research sites and organisations, we've also grown the number of data custodians who sit under the UK Health Data Research Alliance. We've also grown the number of patients and members of the public who we involve. So on this slide, you can see that it mentions the Public Advisory Board, and then in 2020, our COVID-19 group, of which some of you are members, so it's great to actually kind of see your faces and meet you. But in fact, the number would actually be much higher as more and more of the research teams and hubs are recruiting their own panels. And for example, this slide does not take into account your amazing group. So I'm sure this will just continue to grow as well. But before I briefly touch on our patient and public involvement and engagement activities, I just wanted to show you how the kind of governance structure works at HDR UK, because I know it's something that a couple of people had asked for. So as you can see, we have 2 delivery groups down here, the Improving and Uniting Data and the Using Data delivery groups. Both of these have lay members who are involved in making strategic decisions. And then we also have 2 advisory boards over here. The International Advisory Board does have a patient or public on there, and they met for the first time to really provide the international perspective and advice. And then we've also got our Public Advisory Board over here, who feed in directly to our executive group, and were established in January last year, so January 2019. And I really believe that the work of the Public Advisory Board has just raised patient and public involvement and engagement higher on the agenda for HDR UK, and so they really have been a kind of driving force in ensuring that our work is driven by delivering benefits that are for patients and members of the public. My role started in January this year, and before I started, there wasn't a dedicated patient and public involvement role for the central team. And I think the fact that the Public Advisory Board achieved so much in that year before I started really demonstrated to key members of staff, especially in senior positions, the benefits that can come from patient and public involvement. And by kind of committing to and actually hiring a full-time member of staff, I think it's just shown their commitment by saying we do want to invest in this, which can only be a good thing, and even better by the fact that it was kind of pushed forward by the Public Advisory Board. So as I said, I started back in January this year, and one of the priorities was to establish our strategy and approach for patient and public involvement and engagement. So this was a process that took quite a few months, quite a few consultations with different groups of people, but we ultimately developed a communications, engagement and involvement strategy. There were a lot of changes that were made to develop this, but what remained were our 4 goals, and this was to patients and the public are our partners in design and decision making, that the needs and interests of the public are understood and embedded in our work, that people have the trust and confidence in the use of health data for research and innovation, and that people want their data to be used in research. Over the next year, there will be a number of priorities for our patient and public involvement and engagement work. So I've just outlined a couple of these just to give you a little bit of a flavour of it, but I can definitely talk to you about it a little bit more as well. So one of these is ensuring involvement in the development of our data access work. Data access is one area that poses the biggest risk for public trust. So we'll be looking to involve a wide range of people in this. So if you are interested in getting involved, please do get in touch. I just wanted to do my plug there. We're also looking to redevelop and refine our public facing section of our website. If you've been to our website, it can be a little bit confusing, I will admit that. I kind of said it in my own interview, and then I stepped out and I was like, oh, why did I criticize that? But it was a good thing, because it just showed there is definitely room for improvement as well. So again, if you have ideas on what this could look like, I'd really be keen to hear some more. Related to that, we're also developing a communications plan that is specific to patient and public involvement and engagement to showcase the impact the patient and public voice can have in our work and help extend our reach. So this will not just be the central team, it will be across the whole institute, across all the different panels and groups and things like that. So it'd be great to have this group as a case study or something like that as you begin to grow. I'll also be looking to do more to increase the number, but also the quality of involvement and engagement activities across the institute, because it is a real mix. Some are doing really, really well and have established their groups like yours, whereas some are kind of a bit, let's say, early in their journeys. So I really want to ensure that I can kind of connect people with the different teams and organisations that make up HDR UK to support them. And lastly, but no means least, and actually one of the things I'm most looking forward to, is implementing a patient and public involvement and engagement network. So this would be both for the people running the activities and also those who get involved. I hope that it will be a chance for people to meet each other, to share ideas and best practice, and also look at ways to collaborate. I think it's also important to develop it as a support mechanism and way to brainstorm ideas to barriers or issues that apply to a few different teams, such as ensuring inclusion when running online events during this pandemic, an example. So this really was a very brief overview. I had been here for like 6 months before I even knew what the Alliance was. So I really could have spent the whole day talking about the different aspects of HDR UK.
Valid and sources of health data. So, analyzing valid and reliable sources of health data and research is essential for evidence-based decision making and shaping healthcare practices. So, we have Center for Disease Control and Prevention, and like for you can say that for data and research, the CDC is renowned for providing a wealth of data and research uh, on different health topics, and it plays a vital role in disease prevention and control efforts. They offer comprehensive information on infectious disease, chronic conditions, health disparities, and public health surveillance. Uh, the CDC is widely recognized for its data collection methodologies and robust research practices, ensuring the validity and reliability of information they disseminate. And as a trusted source, the CDC data undergoes uh, scrutiny and validation processes. For evidence-based decision-making, healthcare professionals, policymakers, and the general public rely on the CDC evidence-based research to inform decision-making processes and to develop public health strategies and implement interventions aimed at improving population health outcomes. Then we have National Institute of Health. So, National Institute of Health is a leading agency that conducts and funds cutting-edge biomedical research across a spectrum of health issues. And researchers at NIH explore various aspects of health and diseases, publishing their findings in reputable peer-reviewed journals to contribute to the scientific community. For data accessibility, NIH prioritize data transparency and accessibility by making research data available through databases and online portals. So this approach enhances the reproducibility of research findings and allow for further analysis and interpretation by the broader research community. Then uh, for peer-reviewed publication, NIH funded research undergoes peer review processes and ensuring that the studies meet high scientific standards and contribute valuable insight to the field. Researchers can trust the credibility and quality of NIH funding studies published in respected scientific journals. So, this slide, we have World Health Organization and academic journals. So, the WHO, World Health Organization, is a global authority on public health, and um, its efforts to address health-related issues on a wide scale, a worldwide scale, is one of the main duty, and it serves as a reliable source of data, research, and guidance, offering valuable insight into diverse health matters affecting population across the globe. So, World Health Organization publication report and database plays a crucial role in capturing and disseminating information on global health trends, challenges, and best practices. By collecting data from various countries and regions, WHO provides a holistic view of health issues, guiding policy information and policy formation and intervention as well. Then through evidence-based research and expert consultation, World Health Organization issues guidelines, recommendation, and strategic plan aimed at improving health outcomes, combating diseases, and enhancing healthcare system globally. So these sources serve as cornerstone references for healthcare professionals and policymakers. And we have the academic journals. So academic journals serve as primary sources of health research, publishing a wide array of studies, including original research, systematic reviews, meta-analysis, and observational studies. These publications undergo various peer review by experts in the field to ensure methodological robustness and scientific validity. Then some examples of like esteemed health journals include the Journal of American Medicine, Medical Association, then the Lancet and the New England Journal of Medicine. So these journals are esteemed for their high quality research publication that contribute scientifically to advancing knowledge in medicine and healthcare. So basically, academic journals serve as a platform for researchers, clinicians, and academics to share their findings, methodologies, and discoveries with the broader scientific community. By publishing in peer-reviewed journals, researchers contribute to the collective body of evidence and drive advancement in healthcare practice and policy. Health surveys and databases. So, national health surveys, like National Health and Nutrition Examination Surveys in the United States, it plays a crucial role in gathering comprehensive data on population health. These surveys collect information on demographics, health behavior, disease prevalence, and national status, uh, and nutritional status and other key health indicators to assess the health status of the population. Uh, Second point is right. So, um, then the value of data we'll discuss. So health surveys provide valuable insight into trends in health outcomes, disparities in healthcare access, and the prevalence of various conditions within population. So researchers, policymakers, and public health officials utilize these data to identify health priorities, develop intervention, and evaluate the impact of healthcare initiatives. Then, for the health databases, so health databases include electronic health record and disease registers um, like, containing individual level patient data that can be utilized for epidemiological research, clinical studies, outcome assessment, and monitoring diseases trend over time. These databases contribute to evidence-based decision making in healthcare. Then we have international organizations, right? So, okay. So we have European Center for Disease Prevention and Control. So it serves as a key international organization focused on preventing and controlling communicable diseases within Europe, and it generates health data, reports, and research to inform public health policies, enhance disease surveillance, and coordinate responses to health threats and across European countries. Then we have United Nations. Okay. So the United Nations plays a significant role in global health governance and policy coordination through its various agencies like World Health Organization and UNICEF. The United Nations produces health data reports and research that guide international efforts to address health challenges, promote health equality, and achievable uh, sustainable and developmental goals. Then uh, uh, right. So we have covered all of it. To the next slide. Non-governmental organization, professional association and societies and clinical trial research. Right. So first one is the NGOs. So So they have mentioned the example. So the Bill and Melinda Gates Foundation is renowned for its contribution to global health research and advocacy by funding innovative research initiatives and public health projects. The foundation generates valuable health data and research findings that inform strategies to address global health challenges such as infectious disease, maternal and child health and healthcare delivery in resource limited setting. Then we have the MSF is like we can say that Medicine Sans Frontiers or Doctors Without Borders is a prominent NGO known for its humanitarian medical relief efforts in crisis zones worldwide. By conducting field research, providing medical care, and advocating for improved healthcare access, MSF contributes to the generation and dissemination of health data that shed light on health disparities, emergencies, and outbreak in vulnerable population. And we have some professional association and societies. So we have the example of American Medical Association. So the American Medical Association is a leading professional association representing physicians in the United States. Through research initiatives, policy development, and guideline publication, the AMA contributes to advancing medical knowledge, promoting best practices in healthcare delivery, and advocating for health equity and patient care standards. Then we have American Public Health Association. So the APHA is a prominent organization dedicated to public health advocacy and education. By producing research, guidelines, and advocacy materials, the APHA supports efforts to address public health challenges, promote uh, preventive health measures, and advocate for policies that improve population health outcomes. Then we have clinical trials registers. Right. So clinicaltrials.gov we have, and uh, so this clinicaltrial.gov serves as a comprehensive online registry of clinical studies conducted worldwide, and by providing information on ongoing and completed clinical trials, including study protocols, outcomes, and results. The registry promotes transparency, facilitate access to research findings, and enables patient research and healthcare professionals to stay informed about latest development in clinical research. So after that, we have to take all of the important for this slide. So in this slide, we have the conclusion. And so we discuss about diverse sources of health data and research, like government agencies, international organizations, academic journals, health surveys, databases, NGOs, professional association, and clinical trial registry. So they all collective serve as a crucial source of health information and research finding. And each source contributes uniquely to the body of knowledge in public health and patient care. We discussed about the role in evidence-based decision making and policy development. Uh, we have discussed about promoting public health and patient care and advancing health outcomes by harnessing the welfare of information provided by these sources. Stakeholders can pave the way for better health outcome and improve well-being for individuals and communities. So overall, like the critical analysis and synthesis of health data and research from multitude of reputable sources are instrumental in shaping evidence-based practices, driving policy decisions, and fostering advancement in public health and patient care on global scale. And for this one, we have interpret published health data and research. Okay, so for that, you need to first understand the design. Okay. So, interpreting published health data and research is a crucial skill that requires careful analysis, identification of key insight, and an understanding of implication for healthcare policy and decision making. So, we'll discuss about understanding the study design and methodologies. So, I'll start by understanding the study design methodology and basic population. We need to consider aspects such as whether it's a randomized controlled trial, cohort study, a cross-sectional study, or qualitative research. Understanding scope and structure of study is fundamental to grasping its findings. We need to look for the sample size and data collection method. Uh, and identification of potential biases, and we need to be mindful of potential biases in this study, such as selection bias, measurement bias, or confounding variables, and recognizing and addressing biases help in interpreting findings accurately and drawing valid conclusions. Then we have evaluating data analysis. So for that, we have statistical methods. So we need to evaluate the statistical methods employed in data analysis, including descriptive statistics and inferential tests, and understand how data was analyzed and what statistical tests were used to draw conclusions. We need to familiarize ourselves with statistical techniques relevant to the study, and we measures the effect of size, and we look into measures of effect size, and which is used in study to understand the magnitude of relationship between the variables. Effect size provide insight into practical significance of study finding beyond its statistical significance. Uh, then have uh, right. So by following this guidelines and study design element and evaluating data analysis method and understanding statistical measure in published health and research data, we can enhance our ability to interpret finding accurately and drive meaningful insight and apply research outcomes effectively in healthcare decision making and policy formulation. So, have to discuss examine research. So when we analyze the study result, so it's crucial to review the main finding properly, and this involves studying tables, figures, and narrative summaries to identify key trend patterns, relationship between variables. We need to look for consistency across different measures and subgroups to gain a holistic view of the study outcome. Then we have discussed about consider limitation. So as we interpret research finding, and it's imperative to acknowledge the study's limitation, and these may include sampling bias and confounding variables, measurement error, and challenges related to generalizability. And assessing these limitations help us understand the potential impact on validity and reliability of findings, guiding us in critically evaluating the study's conclusion. And, compared to existing evidence. Uh, so, placing the study finding in context of existing literature, it's essentially step in interpretation. So, we compare and contrast the results with previous studies, meta-analysis, systematic reviews, and guidelines to identify areas of agreement, disagreement, or uncertainty. So this comparative analysis will help us draw an informed conclusion and contribute to evolving evidence base in the field. So we have to discuss about assess clinical relevance. So when evaluating the clinical relevance of research finding, we need to analyze how these findings impact patient care, clinical practice guidelines, and healthcare decision making. Factors such as effect size, clinical significance, and relevance to specific patient populations, it all plays a crucial role in determining the practical implication of research. By understanding the clinical relevance, we can better apply research outcomes in real-world healthcare settings. Then consider public health implication. Okay. So for that, understanding the public health implication of research finding is essential for shaping population health strategies and disease prevention initiatives and health promotion efforts. So, we explore how research finding can inform healthcare policy, resource allocation, and resource allocation decision and public health intervention. By assessing the broader public health implication, they can identify opportunities to improve population health outcome and address health disparities effectively. And seek expert opinion. So, seeking expert opinion from researchers, clinical clinicians, and epidemiologists, they all and some other specialists in this field is invaluable in gaining additional insight and perspective on research findings. By engaging with experts through conferences, seminars, and journal clubs. We deepen our understanding of complex research findings, discuss implications for healthcare practices, and explore potential applications in clinical and public health settings. So, all the that. So now we have communicate findings. So when we for that we can say that when communicating research findings, so it's essential to use plain language that is easily understandable by diverse audience, and we need to avoid jargon and clinical terms, and strive to convey the key messages in a straightforward and accessible manner. Clear communication enhances comprehension and ensures that the stakeholder grasps the significance of finding. And then we can use some visual aids, for example, like visual aids such as charts, graphs, infographics, and diagrams are powerful tools for presenting information in visually engaging format. Visual representation can help simplify complex data, highlight key trends, and enhance the audience's understanding of the finding. And we can make data more accessible and memorable for stakeholders. We could be like helping in provide real world example and connecting research finding to real world example and practical scenarios can bring the data to life and make it more relatable to stakeholders. Sharing case studies, patient stories, or example of how research finding could impact health practices can illustrate the relevance and implication of research in a tangible way, and real-world example enhances engagement and facilitate decision-making based on complete understanding. And move to the slide. So we have the conclusion. So interpreting published health data and research is a multi-phase process that involves a deep understanding of study design, data analysis, limitation, and implication. By critically evaluating research findings and considering their clinical and public health relevance, the stakeholders can make informed decisions. They can shape evidence-based policies and ultimately improve healthcare outcomes for individuals and populations. So we need to emphasize the importance of effective interpretation of the health data and research for advancing knowledge, promoting as evidence-based practices, and addressing clinical public health challenges. So these comprehensive approaches ensure that research findings are translated into meaningful actions that have a positive impact on healthcare delivery, policy making, and the well-being of communities. So this was the conclusion. That was the overall lecture about today's class. Do you have any questions? Don't hesitate to ask. Any questions, students? So what we'll do is we will conclude today's lesson and we finish today's lesson. And I'll see you next week. We will discuss about the assignment briefs and other information related with the assessment. So I'll see you in the next class. So everyone, till then, take care. Bye.